Welcome to the Explainer. You know, GLP-1 agonists are transforming medicine at an absolutely breakneck pace. So today, we're distilling the key insights from Dr. Shunzong Bao's fantastic clinical update at the recent St. Bernard Symposium. We're going to explore how these drugs are moving far, far beyond just glucose control and weight loss. Okay, let's just dive right in. The story of these medications is really a story of acceleration. This timeline says it all. It shows just how rapidly the FDA-approved indications are expanding, from diabetes way back in 2017 to now tackling cardiovascular risk, chronic kidney disease, and even things like MASH and sleep apnea. And that breakneck pace is exactly why staying current is so essential for all of us as clinicians.
So for this explainer, we're going to follow Dr. Bao's comprehensive review and break it down into 5 key areas. We'll start with the paradigm shift and how we even think about these drugs, then get into their cardiovascular benefits, their impact on other organ systems, what's next on the horizon, and then finally, how do we translate all this new evidence into our day-to-day clinical practice?
So let's start with the big picture. We all got to know these drugs because they revolutionized diabetes and weight management, right? But their story is quickly becoming so much bigger. They're really evolving from just a focus on glucose to becoming a true multi-system therapeutic class. It all starts right here, with these foundational mechanisms. By mimicking our own natural incretin hormone, GLP-1 agonists hit these 4 key targets that drive their effects on blood sugar and weight. But it turns out, the downstream effects, well, they go way further. And that is really the springboard for all the expanding benefits we're about to dive into.
Okay, let's get into the first major leap beyond just managing blood sugar. We're talking about protecting the heart. And this is where the story truly becomes a revolution for our patients.
The SELECT trial was an absolute game changer. Think about it. For the very first time, we had an FDA approval for cardiovascular risk reduction in patients with obesity and established cardiovascular disease, regardless of their diabetes status. This just blew the doors open to a massive new patient population who could benefit.
Right. So how are they actually doing this? How do they protect the heart? Well, as it turns out, it's not just one single thing at play. And this is what's so cool. It's a truly multifactorial benefit. Yeah, weight loss and glucose control are huge contributors, but these drugs, they go way beyond that, directly impacting blood pressure, reducing inflammation, improving lipid profiles, and even enhancing the function of the endothelium. It's this powerful cocktail of effects that really drives the protection.
And that multi-system effect is a perfect illustration of how this drug class is just exploding into entirely new therapeutic areas way beyond the heart and pancreas. We're now talking about the liver, the kidneys, even sleep.
So let's start with MASH, metabolic dysfunction-associated steatohepatitis. For years, this has been this kind of silent epidemic, and honestly, a huge unmet clinical need. We really had no approved medications to offer our patients, until now. Okay, so then the ESSENCE trial comes along, and the data is just wow. It's striking. Just look at the difference here. After 72 weeks, almost 63% of patients on semaglutide achieved resolution of MASH without their fibrosis getting any worse. Now compare that to just over 34% in the placebo group. You're talking about a near doubling of the resolution rate. That is an absolutely profound clinical result. So what's the bottom line here? It's monumental. For the first time ever, we have an approved pharmacotherapy for our patients with non-cirrhotic MASH and that moderate to advanced fibrosis. This is a true landmark for the field.
And believe it or not, the benefits don't even stop at the liver. First, you have the SURMOUNT-OSA trials, which show that tirzepatide dramatically reduced the severity of obstructive sleep apnea, paving the way for a new approval. And then, in the world of nephrology, you have the FLOW trial, which proves semaglutide significantly reduces the risk of major kidney events and death in patients with type 2 diabetes. Just incredible wins all around.
So, with all this rapid expansion, you have to ask, right? What's the next frontier? And believe me, the pipeline of what might be coming next is incredibly exciting.
So if we're looking ahead, trying to read the tea leaves, heart failure with preserved ejection fraction, HFpF, that seems to be the most likely next big indication. The STEP-HFpF trials showed really significant improvements in symptoms and physical function. And right behind that, you've got PCOS, which is another strong candidate, especially given the central role insulin resistance plays in that condition. But this is where things get really interesting when we start to look at the brain. The preclinical data has been very promising,
And now major clinical trials are actually underway to see if these drugs can actually offer neuroprotective effects in just devastating conditions like Alzheimer's and Parkinson's.
And then, maybe the most surprising frontier of all is addiction. There's early but really compelling research that suggests GLP-1 agonists might modulate the brain's reward pathways that could potentially reduce cravings for substances like alcohol, nicotine, and even opioids. I mean, this could literally open up an entirely new field of medicine. It's wild. Okay, wow, that is a lot of new information to take in. So let's bring it all back down to earth. What does all of this mean for your clinical practice right now?
Think of this slide as your clinical cheat sheet. It's a really clear, at-a-glance view of where we stand today with the FDA-approved uses beyond just diabetes and weight loss. It links the indication to the specific drug and, importantly, to the landmark trial that actually proved its benefit.
And of course, look, while all this potential is incredibly exciting, we can't forget the fundamentals. Sound clinical practice is still paramount, right? It's absolutely vital that we're prescribing these medications only for their approved indications, that we're carefully evaluating contraindications, and that we are diligently monitoring for side effects and potential drug interactions.
So all of this leaves us with a really big question to ponder, doesn't it? Are we just witnessing the rise of a panacea drug class that seems to do a little bit of everything, or are we seeing something even more profound? Could this be the true dawn of a new era of targeted metabolic medicine, where we can finally get at the root causes of so many of these interconnected chronic diseases? I guess only time will tell.